Yeah, so there have been two large clinical trials, randomized international clinical trials, analysing the effectiveness of acalabrutinib in CLL, both in the frontline setting and in the relapsed refractory disease setting. So the ELEVATE treatment-naïve clinical trial is a frontline clinical trial, generally in older patients or younger patients with comorbidities, testing acalabrutinib with or without obinutuzumab, compared to a historical standard of care, which is chlorambucil obinutuzumab. And there was a substantial progression-free survival advantage for both acalabrutinib arms, and NICE have approved acalabrutinib monotherapy on the back of this clinical trial. And then in the clinical trial in the relapsed refractory space, which was called ASCEND, which has also been presented and published, acalabrutinib monotherapy was compared to investigators' choice of a PI3 kinase inhibitor called Idelalisib with Rituximab, or immunochemotherapy, in this instance, Bendamustine Rituximab. And again, there was a substantial progression-free survival advantage for the acalabrutinib group ahead of the investigator choice group. So two randomized clinical trials, both in the frontline and relapsed refractory setting, showing benefit for the patients receiving acalabrutinib. And so NICE approval has been sought and given on the back of both clinical trials. So we have the availability to prescribe acalabrutinib in the frontline setting. There are some restrictions to the prescribing based on the clinical trial that was performed. So patients have to be older patients, so generally those over 65, or they have to be deemed ineligible for FCR or Bendamustine Rituximab, or they have to have a P53 deletion or mutation, which is known to confer a really poor outcome with patients receiving immunochemotherapy. So those are the kind of main indications in the frontline setting. And in relapsed disease, it's basically any patient who's received a prior line of therapy. So the indication is very broad. So this gives an oral, well-tolerated BTK inhibitor option for both the frontline and relapsed space for the majority of patients with CLL, which is great news.